Hello, I am Professor Imam, consultant orthopedic surgeon specializing in shoulder and upper limb conditions. In this short video, I will explain what a rotator cuff tear is, when repair is recommended, and what you can expect from treatment at our clinic. The rotator cuff is a group of 4 small muscles and their tendons that surround the shoulder joint. They keep the ball of the shoulder centered in the socket and allow you to lift and rotate your arm smoothly. When we talk about a rotator cuff tear, we mean that one or more of these tendons have been damaged, either partially frayed or completely detached from the bone. Typical symptoms include pain around the shoulder, often worse at night or when lying on the affected side. Weakness when lifting the arm, especially above shoulder height. Difficulty with everyday tasks such as reaching into a cupboard, dressing, or lifting objects. Some tears follow a clear injury, such as a fall or sudden pull. Others develop gradually over time due to wear and tear, known as degenerative tears. Not every rotator cuff tear needs an operation. Many patients improve with activity modification, targeted physiotherapy to strengthen the shoulder, simple pain relief and anti-inflammatory medication, occasionally a guided steroid injection to settle inflammation. At our clinic, the first step is always a detailed assessment, taking your history, examining the shoulder and reviewing appropriate imaging, usually an MRI or ultrasound scan. Together, we decide whether non-operative management is appropriate or whether a surgical repair is likely to offer you better function and pain relief. We usually discuss rotator cuff repair if there is a full thickness tear, particularly after an injury, you have ongoing pain and weakness despite a period of good physiotherapy, the tear is getting larger, or the shoulder is losing strength over time, your work, sport or daily activities are significantly limited. The decision is individual. We consider your age, shoulder demands, general health and expectations before recommending surgery. In our clinic, rotator cuff repair is usually carried out as a keyhole procedure. Several very small cuts are made around the shoulder. A tiny camera is inserted into the joint so we can inspect the tendons, joint surfaces, and surrounding structures in detail. Special instruments are used to clean the area and prepare the bone. The torn tendon is then brought back to its normal position on the bone and fixed with small anchors. These anchors sit in the bone and have strong sutures attached, which hold the tendon securely while it heals. In some complex cases, a mini-open approach may be used, but the aim is always the same, to restore the tendon back to its anatomical position and give it the best chance to heal. Rotator cuff repair is usually performed under a general anesthetic, often combined with a regional nerve block. A nerve block is an injection around the nerves to the shoulder that provides excellent pain relief immediately after surgery. Most patients go home the same day or after an overnight stay, depending on the complexity of the repair and your general health. Rehabilitation is as important as the operation itself. After surgery, your arm is supported in a sling to protect the repair. The sling is typically worn for 4 to 6 weeks, depending on the size of the tear and the quality of the tendon. In the early phase, physiotherapy focuses on gentle, passive movements to prevent stiffness while safeguarding the repair. Gradually, you move on to active exercises and then strengthening work. As a guide, light desk-based work is often possible after a couple of weeks if your pain is controlled. Driving is usually considered around 6 weeks, once you can safely control the vehicle. Heavier lifting and overhead sports often take 4 to 6 months, and full recovery can continue for up to a year. We provide a structured, supervised rehabilitation plan and work closely with experienced physiotherapists to support you throughout this process. All operations carry some risk. For rotator cuff repair, the main considerations are stiffness of the shoulder, reduced movement, which we minimize with early guided exercises. Re-tear of the tendon, particularly with large or degenerative tears, or if the shoulder is overloaded too early. Infection, bleeding or nerve irritation, these are uncommon but important to mention. Persistent pain or weakness despite surgery, although most patients see a clear improvement in both pain and function. For suitable patients, rotator cuff repair offers significant pain relief, especially night pain, improved shoulder strength, better ability to perform daily activities, and in many cases, return to sports or manual work. At our clinic, you will receive a thorough assessment with clear explanation of your diagnosis, honest discussion of both non-operative and operative options, advanced imaging and minimally invasive surgical techniques where appropriate, a personalized rehabilitation plan with close follow-up. The aim is simple: to reduce your pain, restore your function, and help you return to the activities that matter most to you. If you are struggling with ongoing shoulder pain, weakness, or loss of movement, and you are concerned about a possible rotator cuff tear, we are here to help. To arrange a consultation, please contact our team using the details on screen. We will review your symptoms, examine your shoulder, and discuss the most appropriate treatment options for you. I look forward to helping you get your shoulder and your life moving again.